We're here to present our group project on ethical decision making. Our group consists of Arlise Bias, Robin Burrow, Benjamin Coffey, Monica Johnson, Callan Jones, Sudha Mari, John Prentice, and Jamie Sleeper. What is ethical decision making? In order to properly define ethical decision making, one must first understand several other key concepts that are fundamental to this concept. The first is the 6 principles of ethics that underpin moral philosophy. These principles are autonomy, beneficence, non-malfeasance, justice, veracity, and confidentiality. Autonomy is a person's ability to make or exercise a self-determining choice in the context of respect for others and their right to make choices. Beneficence demands that above all we do good. Non-malfeasance means that we do no harm and have a duty not to injure others. Justice is the equal distribution of benefits and harms in the context of what is deserved. It is centered on the notion of fairness. Veracity is concerned with being truthful, fair, dedicated, and honest. Confidentiality is not divulging information about a person without his or her consent, thus respecting the privacy and wishes of others. Next, we must look at the definition of an ethical dilemma. An ethical dilemma is a problem without a satisfactory resolution. There is no definite right or wrong answer to an ethical dilemma. The basic principles of nursing ethics are shaped by the values, beliefs, and experiences of each individual nurse. Therefore, different choices may be made involving the same dilemma. Ethical decision-making involves applying the 6 principles of ethics and using ethical reasoning to decide on the best action based on the conviction that some actions are better than others. It is a process and an exercise in ethical reflection in response to a specified real-life situation. It is in these situations where the nurse must ask the questions of ethics and strive for the best resolution possible in each unique set of circumstances to find ethical decisions.
Hi, my name is Ben Coffey, and I'm going to continue the discussion on ethical decision making. As healthcare providers, we've seen an increase in ethical issues in healthcare due to the change in interprofessional roles, advances in technology, availability of information over the internet, and increased financial constraints. As the complexity of these issues increase, the role of the advanced practice nurse becomes increasingly important in the identification, deliberation, and resolution of these difficult moral problems. While all nurses are moral agents, APNs are expected to take a leadership role in resolving moral problems, working to create ethical working environments, and to promote social justice in the healthcare system. Hamrick's model of advanced practice nursing is broken down into 4 categories. It's basically made up of a core surrounded by 3 concentric rings. The core is known as the primary criteria, which consists of the graduate education, certification in the specialty, a focus on clinical practice with patients. The central competency, which is the first ring around the core, is your clinical practice. The core competencies are the second ring, and these are made up of direct clinical practice, collaboration, coaching and guidance, research, ethical decision-making, consultation, and leadership. The third ring consists of the critical environmental elements. Ethical decision-making is a core competency that evolved from the central competency of direct clinical practice. Because of the nature of the APN-client relationship, clinical practice gives rise to numerous ethical concerns which the APN must be able to address and resolve. Failing to do so could result in a less than optimal outcome for the patient. Another reason that ethical decision-making is a core competency is because of the expanded collaborative skills that APNs must develop. APNs need to have the ability to avoid power struggles, facilitate interdisciplinary communication, and bring the various team members together in order to resolve difficult issues.
I'm Robin Burrow. John and Ben have already done a good job of defining what exactly an ethical dilemma is. So I'm going to talk about the characteristics, traits of ethical decision making. because there are certain, the nurse practitioner actually is the one that kind of ends up in the middle of the conflict quite frequently, and that can cause a lot of tension for the nurse practitioners. So the three traits are communication problems, multidisciplinary involvement, and multiple commitments. So we're first going to talk about communication problems. A lot of time the problem is not really necessarily an ethical dilemma, it's a problem with communication. So the nurse practitioner has to be really good with communication skills. Active listening, she needs to be good at that, as well as allowing others time to absorb the information presented to them. If they're given that opportunity, it facilitates a resolution to the problem. The second characteristic we're going to talk about is multidisciplinary involvement. As everybody knows, in working in the healthcare system, you got nurses, doctors, PAs, nurse practitioners, clergy, housekeeping, dietary. So there's a lot of people involved in working in the healthcare environment. So sometimes all the disciplines can come together and come to a solution, and other times it actually can be a hindrance. So the nurse practitioner has to be aware of that. An example, the social worker is responsible for helping with the emotional problems of the patient and family, and then like you have the clergy that's responsible for their spiritual needs. The next trait we're going to talk about is multiple commitments. So the nurse practitioner not only has an obligation to the patient and family, and that's her primary obligation, she also has an obligation to the hospital and to the doctors and the other disciplines. For example, the nurse practitioner may feel that a particular test is needed or a particular treatment is needed in the best interest of the patient, while as the doctors or the hospital have said, no, that's too expensive, we can't do that. So she has to maintain her obligations to the patient and the family first and most, with keeping in mind all her other obligations. And in this healthcare environment today, cost is very important.
Hi, I'm Sudha Mori. I'm going to continue the discussion on ethical decision making. First of all, I'm going to discuss very briefly about the principles of ethical decision making. There are 7 basic principles of ethical decision making. The first one is principle of respect for autonomy, the duty to respect others' personal liberty and individual values, beliefs, and choices. The second one is principle of beneficence, the duty to do good and prevent or remove harm. The third one is principle of non-maleficence, the duty not to inflict harm or evil. The fourth one is principle of formal justice, the duty to treat equals equally and those who are unequal unequally. And fifth one is rule of veracity, the duty to tell truth and not to deceive others. Sixth one is rule of confidentiality, the duty not to disclose information shared in an intimate or trusted manner. And the last one is rule of privacy, the duty to respect limited access to a person. John already discussed the definitions of these autonomy and veracity and all these. So I'm going to just go ahead and give the examples of these ethical decision making in the APRN practice. When we come to the autonomy, the example for autonomy is, in case of Jehovah's Witness, the conscience of health professionals may prevent them from accepting the restrictions on treatments demanded by the patient's religious principles. On the other hand, the right to medical assistance and to religious freedom will be observed only if both medical institutions and the health professionals treat patients in a way which respects their beliefs. The responsibility to inform an occupational injury patient about all their options is an example of veracity. Assurance of patient's confidentiality is fidelity. There are a couple of examples here for the beneficence. Resuscitating a drowning victim, providing vaccinations for the general population, encouraging a patient to quit smoking, start an exercise program, talking to the community about STD prevention. These are all come under beneficence examples. Stopping a medication that is shown to be harmful, refusing to provide a treatment that has not been shown to be effective are examples of non-malfeasance. The best interest of the child and the decisions of the parent, for instance, of parent who considers immunizations dangerous and the NP who views immunizations as protective, which are examples of beneficence and justice. More examples are like the husband whose diabetes is uncontrolled and the concerned wife who demands to know the husband's status, which explains autonomy, fidelity, non-malfeasance, veracity, and justice. The NP who considers surgery absolutely necessary, which is beneficence, and the parent who refuses consent for surgery due to the fear, misinformation, or a belief that is harmful, which explains autonomy and malfeasance. And then I'm going to go to the PEDM model. What is PEDM model? It is participative ethical decision making, which explains systematic assessment and resolution of ethical dilemmas, synthesizes ethical concepts of healthcare professionals, and practice and theory based.
Hello, I'm Arlise Bias, and I'm going to present a case study using the PDDM model that was formed by Cal Rowe in order to give some examples of ethical decision making. A 23-year-old mother brings her 3-year-old daughter to the primary care clinic for a sore throat. The child has a 6-month history of loud snoring with documented sleep apnea, persistent tonsillar enlargement, and recurring pharyngitis. The mother brought her child to an ENT surgeon 3 weeks ago as a result of referral, but missed a previous appointment with the specialist. The surgeon scheduled a date for surgical removal of the child's tonsils, but the mother did not bring the child to surgery. She also did not bring the child to a rescheduled clinic appointment. Now, the girl presents with another sore throat. The mother is adamantly against surgery. Now I'm going to apply the steps of the PEDM model. The first step is to identify ethical dilemma. The mother's unwillingness to agree to surgery and the NP's ethics, professional ethics, which require consideration of surgical necessity and possible impact, overruling the mother in an arbitrary threatening manner. Step 2, delineate the values, the variables, and the dilemma. Mother, child, and possibly the community are involved. The conflict is essentially one of who has the right to make decisions for a minor child. Time is of the essence due to the child's sleep apnea. Step 3, assess the NP's perspective of the ethical dilemma. The NP's professional standards require provision of the safest care for all children. The NP brings a wealth of professional knowledge to the dilemma and knows that sleep apnea is dangerous. Advocacy is another principle to consider, especially in the care of a dependent minor. On the other hand, it's important to maintain a supportive, intact, caring family for the child. The NP may believe that the mother's responsibility is to follow through with surgery as prescribed by the ENT. Step 4, assess the patient's perspective of the ethical dilemma. The mother confides that she's fearful of surgery because the child's maternal grandmother advised her against surgery until the girl's 5th birthday. The child's mother relies on the advice and the goodwill of her mother. Clearly, the mother and grandmother need more information. The mother is obviously concerned about doing the right thing for her daughter. She did bring her back to the clinic. She did bring her back to the clinic, which is beneficence and fidelity. And she wants to protect her daughter from the danger of surgery, which is non-malfeasance. She considers her responsibility. However, the mother disagrees with the solution. The mother is adhering to her culture by relying on a maternal authority figure. Her culture may also foster a distrust in healthcare providers. Step 5, share assessment goals in a participative way. Fortunately, the grandmother and mother are able to meet with the NP, who provides information about the risk of surgery as well as risk of apnea. She explains that the primary goal of all involved is to protect the child from harm. The mother and the grandmother expressed their reservations based on a previous experience with surgery. Because of this exchange, the NP realizes that while all parties have the same goal, the perspectives and fears of the mother and grandmother must be addressed. Step 6, identify an ethical framework for resolving the issue. Both parties are approaching the dilemma from rights-based and consequence-based framework. The right to a healthy life and prevention of post-surgical complications with consideration of principles of beneficence, non-malfeasance, and fidelity. Finally, step 7, Identify an acceptable solution. After the NP provides information about safer anesthetics and monitoring available today, acknowledges the mother's and grandmother's concerns, provides support, and identifies a commonality of goals, yes, the mother, grandmother, and the NP reach a conclusion that is acceptable to all.
Hi, I'm Callan Jones, and I will be discussing the outcomes of ethical decision-making. The outcomes of ethical decision-making should focus on two areas, the process and the outcome. The process evaluation offers a synopsis of moral disagreement, the interpersonal skills used, interactions between the parties, and problems encountered during the resolution phase. And according to Olzak, the outcome evaluation should include the short-term and long-term consequences of the action taken and the satisfaction of all parties with the chosen solution. The evaluation of the outcome is important because it provides a time of reflection for the APN to offer creative solutions, create moral action, and ultimately prevent future dilemmas. Debriefing as well as open communication can be beneficial to help lessen the tension even if there is not a satisfactory outcome.
Hi, I'm Jamie Sleeper, and I'm going to continue discussing what current research says about the outcomes of ethical decision-making. Ethical decision-making outcomes can be influenced by numerous barriers. These barriers can be intraprofessional, interprofessional, patient-provider, and organizational environmental. Barriers can inhibit desired outcomes of ethical decision-making. Once the barrier is identified, they can be corrected or eliminated. The limitations of time, reimbursement, and resources conflict with the nurse's moral imperatives of involvement, connection, and commitment. In certain situations, the outcome unveils that changes within the institution or healthcare system are implicated. The APN may need to become involved in advancing these desired changes or identify appropriate resources to pursue them. The resources can be internal, such as chaplain, ethics committees, or social work, or external to the institution, which could be the ANA Center on Ethics and Human Rights, or national ethics groups. In conclusion, the APN is in a central role to manage the resolution of moral issues and aid in building ethically sensitive healthcare environments. It is important that the APN realizes his or her deficiencies in order to produce a favorable ethical outcome. Ethical decision-making skills, together with clinical expertise and leadership, empower the APN to critically analyze and assume leadership roles that promote social justice within the larger healthcare arena.